All right, now, if big government programs like Social Security finds itself on the brink, my next guest says this does not bode well for government-run health care. Even though President Obama now wants to televise or have a televised bipartisan meeting about health care reform later this month, Michigan Republican Thaddeus McCotter says don't expect it to be productive. Congressman, why wouldn't it be productive?
Well, Charles, as we head into it, I think it's more toward political theater. The president refuses to recognize some essential realities. The first is that the reason health care reform hasn't been adopted is because of centrist Democrats and, most importantly, the American public who has rejected it. The president has to change his position from the premise that somehow government supplying the control of health care will reduce the costs. As everyone knows, if you reduce the supply in a time of growing demand, the costs will shoot through the roof. As Republicans, we want to go towards a more patient-centered free market approach which allows the supply to grow to meet the demand and have consumers help to drive the cost reductions. These are principal differences, and I don't see how a half-day meeting in front of TV cameras will change those principal differences.
Well, you know, it's interesting. At first, you know, we heard during the campaign that that this was all going to be seen. The process itself would be televised. Of course, it hasn't been, and now it looks like it may come down to this one-day shootout at the OK Corral. Is the GOP up for this? Are you going to take the bait?
Well, I certainly don't think we should take the bait, especially when Americans, Charles, as you know better than anybody, consider jobs and the economy the #1 issue, not the government-run health care bill that's currently languishing within the Democrat-controlled Congress. But I think you're right in this aspect, too. It might not be the OK Corral, but since Senator Brown was elected in Massachusetts, the president seems to be trying to arrange a shotgun marriage of convenience with Republicans to get cover for many of his proposals. But again, the reality is it wasn't Republicans, however hard we fought, that have stopped health care, government-run health care. It has been the American public and members of his own party.
Congressman McCotter, I think the one thing that the Democrats have been saying that seems to be sticking a little bit with the GOP is the party of no. And it seems like you risk a lot of political capital by not, you know, showing up or at least putting out your ideas in a more cohesive manner. If you do not participate in this, is there some way to, you know, you've hit some bullet points, and that's fine, but it still doesn't explain to the average American how the GOP plan would work. How would you articulate that outside of this televised debate?
Well, we have it online. We've put forward Republican solutions. CBO scored out as saving $68 billion over 10 years and reducing premiums by 10%, relying on free market forces. But I would argue that the one thing that has hurt the Republican Party more than anything else has been our abandonment of principles that put us into minority. The public that is watching us try to regain their trust as people who support liberty, prosperity, and free market principles, the empowerment of the individual, do not want to go see us in front of TV cameras try to cut a bipartisan deal for political convenience. That would be the abandonment of principle that they hope that we have learned our lesson.
But I do think that people would like to see both parties do something, some sort of compromise. And on that note, what in the House and Senate versions of this bill right now is acceptable to the GOP?
Well, I'm not going to negotiate here on TV with myself.
I'm just saying, no, what do you like, though? Is there's got to be something in the plan that looks pretty good to you, no? There is consensus on a lot of the goals of the plan in terms of pre-existing condition and others, but as we always find out, it is not simply the goal, it is how you intend to get there. Again, Charles, you have a fundamental difference of opinion between parties, one which the president himself recognized in his State of the Union. They want government to have more control of health care and its supply to try to reduce the costs. We fundamentally oppose that. If they care to come and meet us on the sane ground of citizen empowerment and patient-centered wellness, we'll be happy to work with them, just as we did on the Afghan surge. All righty. Congressman McCotter, really appreciate your time this afternoon.
Thanks, Charles.
Thanks a lot. Well, fair and balanced.